Hi, my name is Cheryl Carpio, and today I'll be performing a tracheostomy care. I have looked up the doctor's order. I have gathered my supplies. I have my clean gloves and tracheostomy care clean tray. I have performed hand hygiene. I've gone to my patient's room. I knock, let them know who I am. I provided privacy. I let the patient know who I am. Hello, my name is Cheryl. I'll be your nurse today. Would you please verify your name and date of birth? Patient verified their name and date of birth. I would confirm it with their wristband. Okay, I'll let Mr. George know what I'm doing today. Mr. George, I will be performing a tracheostomy care. Is that okay? Okay, so I received the consent, so I'll go ahead and set up. So I would put the bed at a working level. I would raise Mr. George ahead of bed at semi-Fowler or high Fowler position. Perform suctioning if needed. All right, so now go ahead, perform hand hygiene, put on my gloves, my clean gloves, and I'm gonna go ahead and remove the old dressing. I remove the old dressing along with my dirty gloves, perform hand hygiene again. And then I'm gonna go ahead and open my tray. So this is a sterile procedure, so we want to make sure we open the tray away from us. Just like so. I'm gonna go ahead and take my sterile gloves, my drape to set up our clean sterile field. When I'm handling this, I want to make sure that I'm only touching the shiny side, and also the shiny side will be the one laying down. All right, so now that we have our sterile field, we're going to take our tray and dump the content in there, like so. Now our tray is empty. We're going to fill it with normal saline. One of the section, it would be a 1-to-1 ratio, half hydrogen peroxide and half normal saline. So I'm gonna go ahead and put on my sterile gloves. And test that. Now I'm gonna take the inner cannula and put it into our solution, like so. We're gonna take the brush and we're gonna brush, give it a good scrub. All right, and then toss that. So now we're gonna take the inner cannula and we're gonna go ahead and put it back. You wanna put it back. You wanna make sure that you are following the curvature. Just like so. You wanna make sure we secure it. Okay, so now that is secure, we're gonna take these Q-tips. We're gonna moisten them into the 1-to-1 ratio hydrogen peroxide and normal saline. The peroxide, we're gonna use the half and half. We're gonna use if there's any crust, like crusty secretion, that would help clean it out. So we're gonna clean around the stoma, down below. We're also gonna clean the phalange of the the trach. All right, so now that is clean, we're gonna go ahead and take our one of our gauze, and we're gonna dry it off. So we're just gonna tap, tap, tap. Okay, so if we did have another nurse with us, we would ask them to assist us while we take off the trach tie to help us to stabilize it. So since it's just us, we want to make sure we're being careful. So we're gonna go ahead and remove our trach tie. So make sure one hand is stabilizing. All right, the other side. Okay, so now I'm gonna take the new tie, make sure we are holding on to that. Just gonna insert this. All right, so when we tie, we want to make sure that we can still fit 2 fingers. Let me move it a little bit. We want to make sure that we can fit 2 fingers, okay? So let me go ahead and tie that. Okay, and then as you can see, I can still fit 2 fingers under, so we want to make sure it's okay. So now that we have that, we're going to go ahead and apply our new dressing. Okay, just like so. And then we're going to take another gauze, and where we made a knot on the tie, we're going to go ahead, fold our gauze and put it around where that tie is, just so that it doesn't irritate the skin, okay? And then we're going to take a tape. We're not going to tape it on the skin. We're going to just tape the gauze. All right, so just like so. Okay, so now that that is in place, we're gonna make sure that our patient is okay. We're gonna clean up our area. We're gonna place our patient at the bed at the lowest position. Make sure the call light is within reach. Ask if the patient is comfortable and if they need anything. Mr. George doesn't need anything right now, so I'm gonna go ahead and remove my gloves, perform hand hygiene, and go ahead and document what I just did. Thank you.